What if the reason your pain isn't improving is because you're treating the wrong type of pain? Hi there, it's Antony from NxHLife. If your pain hasn't improved, no matter what you try, there is a good chance you're treating the wrong type. Have you ever wondered why your pain just won't go away? Or why some treatment seems to work for others, but not you? Well, not all pain is created equal. And understanding the type of pain you're dealing with is the first step towards real relief. Let's break it down. The most common type of pains include nociceptive pain, neuropathic pain, nociplastic pain, inflammatory or immune pain, ischemic pain, psychogenic pain, functional pain, and somatic referred pain. Each of these has a different root cause, and that means they need different treatment strategies. First up, nociceptive pain. This is your body's natural response to injury or tissue damage. Think of cut, burns, sprains, or even post-surgery pain. It's sharp, sometimes achy or throbbing, and it's actually helpful. It tells you, hey, something's wrong here. There are two types, somatic and visceral. Somatic pain comes from skin, muscles, joints, ligaments, etc. And visceral comes from your internal organs. Usually once the injury heals, the pain fades away. Next, neuropathic pain. This pain comes from damage or malfunctioning nerve, not injured tissues. It feels like burning, shooting, electric shocks, or tingling. You might experience this with conditions like diabetes, shingles, sciatica, spinal cord injuries. Because the issue is with the nerve themselves, treatments goes beyond the standard painkillers. It might include nerve-specific medications, physiotherapy, or brain-based strategies. Now, nociplastic pain. This one often misunderstood. Here, the nervous system misprocesses the pain even though there's no visible injury or inflammation. The pain can be widespread, unpredictable, and persistent. Like in some fibromyalgia, chronic fatigue, or chronic back pain. It's not in your head, but it's happening in your pain processing system. Next up, inflammatory or immune-related pain. It's happening in autoimmune conditions like rheumatoid arthritis, when your immune system attacks healthy tissues. You get swelling, redness, heat, and pain. It often comes in flares and requires a mix of medication, movement, and lifestyle shift to manage. Now, ischemic pain. It comes from a lack of blood flow to certain parts of your body. Without oxygen, your tissues begins to ache or cramp. You might feel this during heart tissues, blocked arteries, or even intense workouts. It's often described as pressure or tightness. Usually comes and goes. Right, let's talk about psychogenic pain. It's pain that may not come from a clear physical source, but it's 100% real. Stress, trauma, and anxiety can all amplify pain signals. It's not imaginary, but it shows how deeply connected the brain and the body really are. Then we have functional pain. This happens when multiple pain types overlap, like nerve sensitivity, inflammation, emotional stress, all are happening together. It's tricky to diagnose, but it's not impossible to treat with a full body, whole person approach. Bonus, somatic referred pain. This is the pain that shows up in one place, actually comes from somewhere else. For example, a neck issue that causes headaches, or a hip problem leading to knee pain. Treating just the symptoms might mask the actual cause. So full body assessment is key. And which type of pain do you have? If you're not sure, you're not alone. Most people have a combination. That's why quick fixes often don't work. At NxHLife, we create the Pain to Peace blueprint to help people decode their pain, understand the root cause, and finally feel in control again. Pain is personal, so your solution should be too. If you're ready to take the next step, join our free 5 days mini course, Secret to Becoming Pain-Free and Loving Life Again. In just 5 short lessons, you will learn the science behind pain in basics and the first step to take control of it. Click the link in the description to get started today. And don't forget to like, subscribe, share this with someone who needs it. Thanks for watching. I'm Antony Lung, and I'll see you in the next one. Bye.